As a dentist, I understand that treating out-of-home care children can be challenging. This video aims to increase the confidence of dental staff when treating children and young people living in out-of-home care. Bridget, can you explain the out-of-home care program?
Sure. The out-of-home care program exists to support children and young people who can no longer safely live with their parents. There are 3 different types of out-of-home care: kinship care, foster care, and residential care. Dr. Ramani, what are some of the barriers affecting the confidence of dental staff?
When we surveyed 100 dental professionals from across Australia, the barriers reported were not knowing how to obtain consent, how to work with challenging behaviours, and how to communicate with a child's carer or caseworker. To help these children, dental professionals need to understand how these barriers can be overcome.
Thanks, Ramani. Let's have a look at Sam's journey through the dental clinic and see what we can learn.
I wish I was in my own house with my mum.
Sam is particularly nervous, and while every child is unique, they have all experienced trauma, often feel vulnerable, and have unmet medical and dental needs. Sam is 11. He has been in and out of foster homes for as long as he can remember, meaning he is shy and reacts strongly to situations he is unfamiliar with. Sam's carer is Kate. Kate has been a carer for 2 years, but has only just started with Sam. Their relationship hasn't been easy, but Sam is starting to open up.
What have I done now?
There are 3 types of out-of-home care arrangements. Sam's, for example, is home-based care, meaning the child lives with a foster carer full-time. There is also kinship care, where the child is cared for by a relative or family friend. And finally, there is residential care, where the child, mostly older child, lives in a home staffed by agency workers. All children and young people up to 18 years with out-of-home care arrangements receive free and priority access to public dental services. In some situations, these children can access private dental services funded by the Department of Health and Human Services. In Victoria, all out-of-home care children should have access to dental care within 1 month of their placement. However, it's important to understand that, unlike other patients, there are more barriers to get children like Sam to attend and to continue to attend dental appointments. The barriers could be complex scheduling arrangements, mistrust of health professionals or perceived cost of treatment, or personal ones that relate to the child's life experiences.
The dentist will hurt me. I've seen the movie.
In all cases, the dental staff needs to be welcoming as well as conscious of the difficulties the carer, and especially the child, faces. The clinics must have a way of identifying the out-of-home care status of a child and collect this information in a confidential and respectful manner. For this first appointment, it was difficult for Kate to get Sam to come.
Are they going to jab me with a needle?
Which is why the first appointment should always be a non-invasive consultation, allowing the child enough time to get to know the dental professional and feel comfortable. Dr. Lane first takes a moment to introduce herself, where she talks in plain language and maintains eye contact. It's important at this point that the dental professional obtains informed consent from the carer and/or the child. Depending on the type of out-of-home care arrangement, the child is likely to be subject to a children's court order. The type of order will inform who can give consent for intrusive medical and dental procedures. These orders include Instrument of Authorisation, which allows the carer to make limited care decisions for the child, Interim Accommodation Orders, where the parent's consent is still required, Care by Secretary Order, in which the appointed secretary needs to provide written authorisation, Long-Term Care Order, where the carer can consent to all medical procedures. Finally, if the child is aged 14 or over, they can give consent for themselves as long as they have the maturity and capacity to make an informed decision. Once consent is established, the clinician should check the child's medical records. These records are often insufficient as the child may have had multiple placements or had little to no contact with the primary care system. It is important for dental professionals to understand the circumstances and that the carer is not responsible for the lack of medical records or for the child's current oral health. Child's medical history is available electronically on My Health Record, but if the records are not sufficient to proceed with the treatment, then either the clinician should take a complete medical history or get the carer to take the child to a general practitioner to get a medical examination done. Dr. Lane begins by explaining what this first appointment is for and assuring Sam that they won't progress with any procedures until he is ready. Using age-appropriate videos or imagery, Dr. Lane explains the various pieces of equipment and what they could be used for. Due to past experiences, it's important to be mindful that anything could be a trigger to challenging behaviours. Dr. Lane builds rapport with both Sam and Kate through active listening, demonstrating warmth and genuineness, involving them in making informed decisions, and allowing them to ask questions. This helps to manage potential triggers and barriers.
It's not as scary as I saw in the movie.
Finally, Dr. Lane encourages preventative dental care, providing Sam and Kate with a dental pack and showing him how to use everything correctly.
I like getting presents. This toothpaste is yummy. Bubblegum.
Following the first consultation, Dr. Lane ensures that further appointments are made to continue developing the relationship. Continuity of care is vital for a relationship to develop, as well as for dental warning signs to be observed. After each appointment, Kate will pass the details on to Sam's case manager at the Department of Health and Human Services. It's essential that everyone involved takes ownership of Sam's oral health. Sam is one example of the kind of children that come through the out-of-home care program. They can be a wide age range and exhibit radically different behaviour. Understanding the barriers faced by children in out-of-home care and using the recommendations advised in this video, a clinician can get a positive outcome for these children. For more information, please visit this website